Now it's time to turn our attention to this week's honoree. This doctor is using her years of experience to help expectant mothers in places where care is difficult to come by. Take a look.
This is New Yorker of the Week.
They're basic medical supplies packed to make a world of difference. Dr. Shirazian understands just how much. She visited a health clinic in Africa and saw what little access women had to adequate care.
I can't even imagine, what they must feel then being there, knowing that there's no one there to help them. There are no resources, there's no basic providers to take care of them.
Tara is trying to change that. 5 years ago, she co-founded Saving Mothers. The nonprofit works to decrease deaths during pregnancy and childbirth in Guatemala, Kenya, and the Dominican Republic.
So our goal is really to give back to women in ways that are the most sustainable. And that is to actually teach and train their local doctors, nurses, community health workers, traditional birth attendants, whoever is there on the ground taking care of women.
There is a saying that to be pregnant is to have one foot in the grave. And that broke my heart when I heard that. And getting to know Dr. Shirazian in this organization has taught me that it doesn't have to be that way for these women.
These volunteers teach caregivers how to identify emergencies and perform safe deliveries. And every month, they provide these communities with simple but life-saving items.
It's a shower curtain that we put down underneath the woman. It's gloves, it's sterile instruments, gauze, but it really can save a life because without these instruments, without these supplies, the babies, the mommies can get infected.
Saving Mothers has touched the lives of hundreds of women.
One of the life lessons that I've learned in being involved in Saving Mothers is how little it truly takes to give back. It doesn't take a lot of money. I think it takes sometimes a lot of love and dedication, but it doesn't take a lot out of you to give back.
And so, for giving expecting mothers the tools to protect themselves, Tara Shirazian is our New Yorker of the Week. And joining us now in the studio is our New Yorker of the Week, Dr. Tara Shirazian. Thank you so much for coming in and sharing your story with us.
Thank you so much for having me. It's really an honor.
Well, it's great to have you here. Let's go back to the beginning. The first trip to Africa, what did you see?
I mean, it was amazing, the disparity between care that women receive in Africa and in other places that we've been. We saw many women laboring in beds together, so they would sleep many women in one bed often. We saw the providers not having good systems in place to really understand which needs are the most acute, who has the biggest emergency, who should they see first. We saw lack of basic supplies. So we actually were in Liberia before the whole Ebola crisis broke out. And there weren't any gloves, there weren't any basic towels, there weren't any basic supplies to take care of women. There was no suture for C-sections. I mean, the list is endless about the lack of basic resources.
Yeah, and no resources at all. There are no other organizations, or there are organizations, but the problem is just so grand.
The problem is huge, and really the issue, I think, is a human rights issue. I mean, over 350,000 per year, women per year die in pregnancy and childbirth. I mean, those numbers are astronomical. I mean, that many women dying in pregnancy when it should be a happy time. When we don't lose women here in the U.S., it's usually a great time for most women, is, really a catastrophic event for many women in many places.
And you step in offering some basic needs.
Yes.
And it's not just the birthing kit and what goes in your packet here. It's also education, but we'll get to that. But let's go through what it is that you're actually providing these women.
Sure. So I think that the biggest thing that many people don't really know about global women's health is that the people taking care of women and delivering women are not typically trained people. So there are not a lot of doctors, there aren't a lot of nurses. For example, in Liberia, there were 3 trained OBGYNs to serve the entire country. And that was, about 5 or 6 years ago. So we teach and train whoever is there taking care of the large masses of women. So it's a basic instructional sheet with basic, flow sheet that teaches the provider, however skilled they are or unskilled, what steps are needed to provide a clean, safe delivery. And then on the back are warning signs in labor. So the idea is you don't even need to be literate to be able to understand this flow sheet diagram, to truly be able to refer a woman when she has a headache or fever, when she's shaking, when she's bleeding too much or laboring too long. So this is meant to be a basic sheet so that any level of provider can refer women in the event of an emergency. And the things in the kit are also very simple. So we added Purell, which we know very well here in the US, but globally it's unheard of. When we first introduced Purell in Sierra Leone and Liberia, people looked at us like, what is this? You know, they had never seen anything like it before. There's no basic running water, there's no clean water in many of these areas, so Purell can be life-saving. A basic pair of gloves is also key. We take these gloves for granted. When we first introduced them in Guatemala, the birth attendants would just wear one glove. They would tell me they were saving the other glove because they didn't know if they would ever get another glove, so they only wanted to use the one that they needed. And when we reassured them that we'd be providing them with more gloves, they became a little more comfortable using both. But it's basic supplies, it's also teaching and training, so we never send out things and don't know where they went and or who received them. We also provide a training program for whatever resources we send out so we can make sure the local providers know how to use them appropriately, and that they're culturally appropriate for the needs of the community.
So how can people help you? You might get someone running to the store to buy a whole bunch of Purell.
Yeah.
What can people do to help your organization grow?
Well, thank you. So Saving Mothers, these birth kits are $10. They cost us $10 to make. And so for $10, you can save a woman's life. We provide basic programs, as we said before, in Guatemala, in the Dominican Republic. We provide free surgeries, actually, for women who don't have access to care, surgeries for fistula, for prolapse, for fibroids, for all kinds of basic women's health needs. And in parts of Africa, we're rolling out a new prenatal program in Kenya. So I invite everyone to visit our website at savingmothers.org. Please donate, please help us give back to women globally, and please help us stop this human rights violation for women globally.
We're going to have that website once again for our viewers in just a moment. I want to, in the minute we have left, just ask about your big vision for this organization, Saving Mothers. You're in 3 countries now.
Yes.
You've also talked about Africa, Sierra Leone, and Guinea. Where do you envision this going? Big picture?
Well, I think there are a lot of great nonprofits out there doing a lot of great work. We want to provide the set of skills and programs that we know best. So I'm an OBGYN. I'm a gynecologist here in New York City at Mount Sinai. So I really provide care for women in pregnancy, delivery, and gynecologic care. So we want other nonprofits to use our expertise in this particular area for their programs globally. Use our birth kits. We're trying to create translatable programs that would make the biggest difference for women globally. So we want other groups to hopefully find our interventions useful and helpful and use it in the areas in which they work. Because the idea is that with these simple, low-cost, high-impact interventions, they should be able to help women everywhere. We don't need to be everywhere, but we'd like other groups to benefit from these programs as well.
Get the message out on your behalf.
Yes, exactly.
Thank you so much, Dr. Taraneh Shirazian, our New Yorker of the Week.
Thank you so
much. Once again, for more information, you can visit savingmothers.org. That's all the time we have for now. I'm John Shumo, and I'll talk with you Monday.